Welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. And today's special guest is Amy Linder, president of the United Way of Greater Milwaukee and Waukesha County. So Dr. Raymond, let's start with the health update.
Thanks, Tim, and good afternoon, everyone. Yesterday, we discussed that we're in a time of transition. Importantly, we're transitioning from the urgent need to flatten the curve of the COVID-19 pandemic, which we've done very well in Wisconsin, as you can see on this slide, which shows the daily new cases of COVID-19 in Wisconsin since early March. To summarize, we've avoided a surge that could have overwhelmed our hospitals. We've pushed our doubling times out past 2 weeks. We've dramatically increased our testing capacity, with even more to come in the near future. And our public health community is coming together to improve our ability to identify and trace contacts of people infected with COVID-19. I'd like to thank you and the MMAC for helping to guide us to where we are today and for leading the way in balancing our responses to the health and the economic challenges of COVID-19. Now we're also transitioning to carefully and thoughtfully reopening our economy and to keep our people safe when they leave their homes and they're at work. Our focus now will transition in part to the gating criteria in the Badger Bounce Back Plan, some of which are still under development. And those of you who were on the MMAC M7 webinar earlier today on business strategies during the pandemic were able to learn about new data tools coming out from the Wisconsin Hospital Association. And during yesterday's daily brief, we talked about the new tools available on the Wisconsin Department of Health Services website. And as we move into the next few weeks, we'll be tracking new metrics for us to align with the Badger Bounce Back. Also, we'll share selective new data from the WHA and DHS websites as needed. Next slide, please. Next slide, thank you. With the increase in the number of tests at the end of last week, we will detect more people who are infected with coronavirus, as you can see on this slide. The positive tests for each day are shown in pink, and those have increased over the last week. Total tests are shown in light blue bars, and those also have increased over the last week. And we'll begin tracking the percentage of positive cases as shown by the black lines on each of the panels. And these are important gating criteria of the Badger Bounce Back Plan. Next slide, please. As you know, we've been talking about the shortages of personal protective equipment that make it difficult for us to treat patients with coronavirus. And although there still are serious supply chain issues for PPE, you can see some recent improvement shown by the downward trend of the number of hospitals in our region and in Wisconsin with critical shortages of PPE as measured by a 7-day supply on hand. But PPE shortages will remain a significant challenge for us going forward. Now, I'm pleased to note that both the DHS and the WHA will be tracking that for us as we go forward. Next slide, please. This slide shows the number of hospitalizations requiring ICU care in Wisconsin and in Milwaukee. And because we flattened the curve, we've not overwhelmed our intensive care units with coronavirus patients. And the trends are going in the right direction with a slow decrease in coronavirus-related ICU admissions. This is good news, and I want to thank everybody for their diligence. But to remind everybody that diligence and social distancing are going to be important as we reopen our economy. Next slide, please. And on this last slide, I wanted to give you an update on new CDC guidelines for pets. These guidelines address some of the most frequently asked questions about COVID-19 from the daily brief. Now, we know that some coronaviruses infect animals and that these can be spread to people, but this is rare. Although we do know that COVID-19 is thought to have spread from bats to pangolins to humans. At this time, there's no evidence that pets play a significant role in spreading the virus that causes COVID-19, although there is growing evidence that cats and ferrets in particular can carry and possibly become ill from COVID-19. Dogs seem to be less susceptible, but there have been a number of reportedly positive COVID-19 tests in dogs. So new guidance by the Centers for Disease Control and Prevention today suggests that we should treat pets like we would treat any other human family members. Don't let pets interact with people or animals outside of the hospital. And if a person inside the household becomes sick, do your best to isolate that person from everyone else, including pets. And if you're curious, that is me with 2 of my 3 dogs in the right-hand slide. And those are 2 rescues from the Elmbrook Humane Society. So again, I thank you for your attention. And with that, I'll turn it back to Tim.
Thanks, Dr. Raymond. Another reason why if we have any COVID in our house, I'll be back in the doghouse. So thanks very much for the update. And on a more serious note, as you get into the data in the coming days, one of the things I think that's really going to be helpful is the explanation of what some of these indicators to mean. As a layman, when I see the term that the ICU units are at 75% capacity, I get concerned. But if you're running a hospital, as you know, you're running those ICU units at pretty good capacity to begin with because they're expensive to run and you want them to be used. So I think that's a good caution. You want to just talk a little bit about that one as an item?
Yeah, thanks, Tim. Our units are actually running at a much lower occupancy than that, so they're not very efficient. 75% is generally viewed as the most efficient way to run an ICU. But we have to be careful when we set these metrics or gating criteria up to recognize that not every region and not every hospital run the same way. So in our region, we have flagship hospitals, Columbia St. Mary's, St. Luke's, and Freighter that generally run at a higher occupancy level in their ICUs, but there may be capacity in some of the other hospitals, especially in the large systems. So a one-size-fits-all approach might not always be the best way. And I know we're trying for simplicity in these metrics, but there needs to be a little bit of flexibility depending on the situation in the different regions.
Yeah, I think that's very helpful. Well, Amy, I know that this has been a challenging time for the community, and this is where we really benefit from your leadership and the work of the United Way of Greater Milwaukee and Waukesha County. So you want to talk a little bit about what the United Way is doing above what it normally does in a situation like this.
Absolutely, Tim, and really appreciate that framing. Everything that United Way is doing now, and I'm going to get into that in just a few seconds, is happening on the backdrop of 100+ years of being connected to this community, of knowing our donors, of our donors trusting us to know in times of crisis, like in any time of the year, United Way has a really good pulse on where are the investments that are really needed in our community and where can we have the biggest impact. So next slide, please. About 5 weeks ago, sorry, waiting for the slide, there we go. About 5 weeks ago, we started fundraising specifically for COVID-19 urgent needs. And we're checking with our agencies every single day on what those needs are, and then looping back to our donors to make sure individuals in the community can understand how they can have an impact during this really difficult time. We're seeing a great response from the community. We all know we live somewhere really special, and one of the ways we see that is the way people care for each other here. We're making investments all over sort of our 4-county footprint, so that's Milwaukee, Waukesha, Ozaukee, and Washington County. That's happening in housing at projects like the Clare House. We're doing staffing support for shelters so they can be open 24/7, so individuals experiencing homelessness have a safe place to be during the day. We are buying food for pantries and individual agencies supporting members of the community. We're sending diapers to early childhood care programs, medical and cleaning supplies for all kinds of programs that are functioning right now, and so much more. Really proud of everything the community has already responded on, but also want to caution that although we're doing a lot with the help of the community, this is going to get worse before it gets better for some members of our community, so we can't take our foot off the gas in the fundraising efforts that we're doing or in the investments we're making right now. Next slide, please. Want to make sure everybody has had a chance to hear about this incredible project we're involved in called Mask Up Milwaukee. This is a partnership with a lot of organizations. The logistics are coming out of the Pfizer Forum and the Bucks organization. where we are spearheading an effort to have the community step up to make 3.5 million masks that will be distributed across our footprint. These are no-sew masks, so those of us who forgot to learn how to sew before now have a chance to help. We've been absolutely overwhelmed in a good way with how many members of the community are responding. In the first 4 days that we had registration open, we had almost 1,200 people sign up to do this. If this is something you'd be willing or able to share in your own networks, huge need remains. There's going to be at least, we think, 3.5, 4.5 weeks of signups for this. It's a really well-run process. It's something to do in front of Netflix. If you think you can help, please check out the website on United Way's website and see how you can get involved. Next slide, please. In addition to the work that United Way is doing in our own shop, we're also doing sort of an unprecedented level of collaboration between funders across the community and some great corporations. This is always the case here in Milwaukee. Really want to highlight the great work of GMF and others. We have 6 pillars under this combined Milwaukee Responds effort. United Way is leading the housing and shelter pillar, but lots and lots of good work happening there. Encourage you to go to GMF's website if you want to learn more about that. Next slide, please. Finally, I'm hearing this quote along a lot right now that although we're all in the same storm, we're not all in the same boat. The reality is a lot of members of our community were in crisis before this pandemic, and that there are underlying inequities both in our community and society that's leading to higher infection and death rates in the African American and Hispanic communities, in particular here in Milwaukee and elsewhere. We also know there's some class issues here. Those individuals who have a blue collar job, traditional blue collar job, are much less likely than some others of us to be able to be safely working remotely or to be put in situations where it's hard to social distance in your jobs, and we're going to keep seeing that play out. We know some families don't have the same access to remote learning opportunities as families in other communities or other neighborhoods. So just want to highlight all of this going on and talk about United Way's commitment to these underlying equity issues and the really horrific ways we're seeing it play out right now when we don't have equity at the levels we absolutely should be having it. Want to highlight one non-COVID thing that United Way is working on. Under the leadership of our Diversity Leadership Society, we're working to reduce barriers to employment for the African American individuals in our community and the really big gap between pre-COVID numbers of unemployment for African American individuals as compared to other individuals. Tim, I know we've worked with your team on this one. It's going to be a continuing effort here at United Way, and we welcome everybody's partnership. So if we go to our last slide, I'm happy to take any questions that we might be able to be helpful on.
Great, Amy, thank you very much. I'll bring Dr. Raymond back in here and really appreciate the focus and breadth of the work of the United Way, and kind of very interesting discussion on the challenges faced in more of our urban areas. And as Dr. Raymond and I have talked about that, and look at that, he's all suited up for the show. But as we've talked about the work that you're doing on that last slide, and we look at Milwaukee County, Brown County, which is Green Bay, and Dane County, which is Madison, the 3 counties that account for about 65% of the state's cases, it really is impacting in a different way parts of our community. And so, Dr. Raymond, I'm interested in your comment on that, and then Amy's in terms of just providing services.
Why don't we let Amy start? I'm on her board, but she's really the one running the show.
John is not only on our board, he's also one of the co-chairs for the campaign this year. So super grateful to see you suited up and all the great work you're doing this year, John. We really appreciate you. There's whole dissertations, of course, that are written on this, Tim, and should be written on this in terms of how do we find ourselves in this place. I think what I'd like to highlight is early on, I was hearing a narrative of people in certain communities weren't understanding the message, or people in certain communities weren't taking as seriously the guidance as other communities were. And I've been really heartened in sort of the change in narrative and the change in tone over the weeks to say, hey, this isn't about what people want to do. This is about how healthy were people when this started. This is about who can choose not to go to a job for a week or 3 weeks or 6 weeks, whose jobs afford them the protections of social distancing, masks, and for some of us, the ability to work remotely. These aren't individual choice problems by and large. These are systemic inequities in our community that we all have to be serious about fixing if we hope to avoid terrible results like this continuing now and in the future.
Thank you. Chris, questions?
Yeah, first question for Amy. We had several people write in basically asking, how can I help? And obviously you'd have an outlet for donations, but my question for you is in-person volunteer opportunities are such an important part of what you do. How can you sort of shift and have people do some of the same tasks remotely, or can you?
Yeah, we have very limited. Please go to our volunteer section of our website if you're interested in how you can volunteer. Most times of the year, you're going to go there and you're going to see hundreds of in-person volunteer opportunities. If you go there now, and please do, you'll see those are really few and far between right now. There's a couple of delivery options where maybe you're helping getting food from a food pantry to an individual household that might be isolated, or a couple other very discreet, very safe ways to do in-person volunteerism. But most of the opportunities that are up there right now are virtual. So there are things like, can you be reading to little ones for our community to help them keep up or catch up in their literacy skills while they're not in school right now, if the families have access to that kind of remote capability. There are new immigrants to our community who very much want to be practicing their English skills, that you don't have to be an English teacher. If you can speak English, you can volunteer to help others get more comfortable with the English language, help their job skills, help them as people. The Mask Up Milwaukee project is the biggest volunteer project our United Way has ever lifted. It's thousands of volunteers, it's thousands of product, and our ability to do that is because of the great infrastructure we had in place. So what we were doing was creating a very safe way to pick up these kits. The people at MCW helped us design that process to make sure that we're doing a health screen before people are picking up those kits, so we know it's safe to give them the kits. We're doing a health screen on the other end after you drop off your box before we distribute those boxes. So we're making sure we're not distributing a box from anybody who might have been sick during the time the box was in their possession. As is always the case, we hear the question, how can I help? So often, and here in our community, when people ask that question, they're not just asking, they really mean it. So really encourage you to go to United Way's website and find out how you personally might be able to help.
Dr. Raymond, we had a question about the state allowing some non-essential businesses opening for curbside service. Do you expect that to have a major effect on the number of new cases, and what should either employees or consumers be aware of as that situation develops?
Well, we're doing an experiment. We're trying to balance the health risks and our economic peril that we're in right now. I think if people maintain proper social distancing and continue to have diligence in the way that they protect their personal space bubble, that we'll probably be okay. And we're all hoping for that.
We also had several questions about pet safety. One, is it okay to go to an animal shelter or maybe to bring home a rescue pet right now? Are there any concerns about that?
Good question. I know adoptions have been up for rescue animals, and I haven't heard of any problems with that. So I would encourage you to rescue animals if possible. Dog parks, the CDC did specifically mention that if you're concerned, you probably shouldn't have your dog interacting with other dogs that might be living with humans that have COVID-19. I know that's a hard lift, but it is a recommendation. They also recommended tight leashing so that you could keep your dog away from other dogs and other people.
We also had one more question about antibody tests becoming more widely available. And on a related note, is there any way to know the infection rate of the general population? I know there have been some states that have done more broad testing.
Yeah, I think we need well-validated tests, which some of the studies actually have not used. And I think there have been some overgeneralizations about those questionable results. We need to do testing right here in Wisconsin. I believe that we're going to have a very large quantity of antibody tests that'll be available here in the next few weeks, and the laboratory backup to be able to perform them. So we're going to know a lot more about the prevalence here within the next couple of weeks.
Great. Thank you, and thank you to everyone who asked a question today.
Yeah, Dr. Raymond, again, thank you very much. Amy, thank you for being with us, and thank you for your leadership in a very trying time for the community. Tomorrow, we're going to be joined by Chris Miskell, who's going to talk a little bit about treating COVID-19 patients with plasma and their recovery. So a very interesting topic as we head through the rest of the week. So again, have a safe weekend or safe rest of the week, not at the weekend yet. Dr. Raymond, Amy, thank you again.
Thanks so much.
Amy. Thanks, Tim.